Did you know that for every 10 people that die of stroke, 4 could have been saved if their blood pressure had been regulated? Good evening. Welcome to Sound Health on Lagos Television. I am Olasunbo Modupe. Today we are looking at stroke. What causes stroke? According to the World Health Organization, about 15 million people worldwide suffer this condition. The conversation begins after this break. Please stay tuned.
Some threats aren't obvious. In our homes, our communities, our cities, they're always among us, often unseen, hiding in plain sight. Non-communicable diseases like cardiovascular diseases, certain types of diabetes, cancer, chronic respiratory disease can affect us quietly. And every year, they take millions of lives. Most often, they are influenced by the world around us, factors outside our control. But the power to prevent and manage them is in our hands. Change isn't only possible, it's already within our reach. By addressing the underlying health and risk factors, by meaningfully including people living with non-communicable diseases into decision-making, understanding how environments and policies put us at risk, by supporting bold, inclusive, non-communicable disease policies like high taxes on cigarettes and other unhealthy products, decreasing the salt and fat content in our food, and ensuring access to essential medicines, we can build healthier futures for everyone.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Professor Kolawole Wahab. He is a professor of medicine at University of Ilorin and consultant neurologist at the University of Ilorin Teaching Hospital. And he is going to tell us what exactly is stroke and how to prevent the rise in this condition among young adults. Good evening, Professor Kolawole Wahab, and thanks for joining us.
Good evening, everyone. Good evening, viewers at home. Thank you so much for having me.
All right, you're welcome. According to the World Health Organization, about 15 million people are affected by stroke annually. What exactly is this condition and why are we seeing a rise in this condition?
Right, so thank you very much. Stroke is indeed a very big burden, and it's like becoming an epidemic now. So when we talk about stroke, I need us to go back to what happens in our various houses and look at maybe our kitchen, for instance. You know, you have your wash hand basin in the kitchen, and you get water from the wash hand basin, but the water comes from a source. Okay, so let's say for the case of argument now that the water is coming from a tank. So this water gets to your house from a network of pipes. Okay, so if the pipe bursts on the way, okay, you won't have water coming into your wash hand basin. Okay, and if it gets blocked, you won't have water either. So when stroke occurs, the pipes supplying blood to the brain gets either blocked or they rupture before getting to the brain. And in either case, blood is not supplied to the brain. And the way God has created the brain, it's solely dependent on blood because it derives its nourishment from the blood that gets to it. So when blood does not get to the brain, then the area of the brain that is starved of blood dies. And that is when we say stroke has occurred.
Okay, and thank you for that detailed explanation. It is basic enough. But I would also like to know, why does the brain experience disruption in the blood?
Okay, so thank you again. All right, so the way these pipes are, they are regulated. Okay, so what happens is that if there are risk factors that can lead to blockage of this pipe or that can lead to rupture, then you have a consequence, that is the stroke. So then the question is, what are the things that can lead to blockage or rupture of this pipe? So that will take us to the risk factors for stroke, because those are the drivers of the increasing burden of stroke. So we have things that we can modify, and we have those ones that you can't do anything about. We call those ones non-modifiable risk factors. And I'm going to start with the non-modifiable risk factors. So things like your age, like your sex, like your race, you cannot modify them, because with increasing age, the risk of developing stroke increases. Stroke is more common in males compared to females, and blacks are at higher risk of developing stroke compared to whites. Okay, so these are some of the non-modifiable risk factors, including genetic, because if my dad has suffered a stroke, that puts me at an increased risk of developing stroke compared to someone whose dad did not suffer from stroke. So these are the non-modifiable risk factors. But then we have the ones that we can modify. And these are the ones that we actually need to focus a lot of attention on, the modifiable risk factors. So the leading modifiable risk factors for stroke are about 4 of them. Okay, but the chief among them is hypertension. Is the dominant modifiable risk factor for stroke all over the world. And the twin brother of hypertension is diabetes. Okay, when one is not able to regulate blood sugar, and you have increase in the level of blood sugar. So when this happens, the person could be at a high risk of developing stroke. Then inside our blood, we have things that we call fats. Now, these fats are of 2 types. You have the ones that are protective, and you have the ones that are hazardous. Okay, so when you have increased level of fat on its own, it's a risk factor for stroke. If you now have higher level of the hazardous one, it's a risk factor for stroke. When you have low level of the protective fat, it's another risk factor for stroke. So this put together, we call it dyslipidemia. That is problem with handling of fat. So this is another one. So another one is smoking, and smoking of cigarettes. And these days it goes beyond cigarettes because we have a lot of recreational drugs that are being used. Smoking of marijuana, use of cocaine, use of heroin. These are potent risk factors for stroke that we can control. And then alcohol consumption. There is no safe level of alcohol according to the World Health Organization. So whether one takes a unit or takes 10 units, the risk is going to increase proportionally to the number of units of alcohol consumed. So these are some of the drivers of the increasing burden of stroke in Nigeria.
All right.
And indeed in Africa.
All right, Professor Wahab, and from your experience, years of experience, have you seen patients that are not smoking, that are not into alcohol, come up with stroke? Are there other causes? Are there other lifestyles, increasing our risk factors?
Absolutely. So there are other things, okay? Like one of the things is westernization, okay? Because we've westernized, we've imbibed some things now. People exercise less, and people smoke. I've mentioned smoking earlier on, okay? And we take a lot of junks. Okay, so all these tend together to increase the possibility of getting obese. And obesity is one of the modifiable risk factors for stroke. So obesity is one of those things. Now, aside from this, we have things that can occur in the heart. Okay, so the heart can be likened to the tank I mentioned earlier on, because it's the one that pumps blood around the body. So when there is a problem in the heart, either from birth or when it's acquired after one is born, okay, so you can have a problem in the heart that can lead to stroke subsequently. So these are some of the other things that can lead to stroke.
Okay. Are there types of strokes?
Yeah, we have two basic types of stroke. And in the analogy I made earlier on, okay, when you have the pipe getting blocked before it gets to the house, in this case, the pipe gets blocked before it gets to the brain. We call that one ischemic type of stroke. That is, blood supply to that part of the brain is cut off. Now, the other type I mentioned is the fact that the pipe can rupture before it even gets to the house. In this case, the pipe ruptures before it gets to that part of the brain that subserves a particular function. So if that happens, we will say that there is a hemorrhage that is bleeding into the brain. Okay, so these are the two types of stroke. We talk about ischemic stroke, we talk about hemorrhagic stroke.
Okay, because the more reason I asked that question, oftentimes you hear people say he had mild stroke, he just recovered from stroke, while others have not been so lucky. The World Health Organization says it is one of the causes of disability worldwide. We've also seen cases where some people slump and they, from there they pass on. Are there any differences, and how do you think we can mitigate this rise?
All right, so the one you're talking about is the severity of the stroke. Okay, so you have two types, ischemic or hemorrhagic type of stroke. And any of these could be mild in severity, could be moderate in severity, or could be severe in severity. Okay, so that is the grading of severity of stroke. So a person who says that he suffered a minor stroke could have had a mild form of stroke. Now, stroke is one of the leading causes of death globally. And in actual fact, up to about 2/3 of those who recover from stroke may have permanent disability. So the main thing is to prevent it from occurring. That's actually the best way to approach it, because the best is to prevent. They say that prevention is better than cure. So that is actually the focus. So how do you now mitigate this? How do you prevent stroke? So if someone is hypertensive, he needs to, number one, you may not even know that you have hypertension, because I've mentioned hypertension as the major driver, is the dominant risk factor for stroke all over the world. But the thing there is that in Nigeria, the prevalence of hypertension, that is the number of people who have hypertension, is about 40% of the population. That means 4 out of every 10 Nigerian adults will have hypertension. So that is huge. But the thing is, more than half of these are not even aware that they have hypertension. And of those who are aware that they have hypertension, more than half are not on treatment. And of those who are on treatment, more than half are not even controlled up to target. In actual fact, from our studies, we found out that just about between 8 and 10% of those who have hypertension are controlled to target. So leaving us with a huge number, 90%, that are not controlled. And these are the ones that are prone to developing hypertension, to developing stroke. So if one has a risk factor and it's been diagnosed that one has hypertension, one will need to take his medication regularly. Okay? One will need to adapt to the situation, and then you need to take to the advice of your doctor. There will be some lifestyle modifications that the doctor is going to advise on. So the person should keep to them. Then I said the twin brother of hypertension is diabetes. That is when the person is not able to handle blood sugar very well. So there are lifestyle changes that will be recommended by the doctor. So the person will need to take to those ones, in addition to using medication.
All right.
Now,
please go ahead, sir.
Okay, so now I've talked about some other things like smoking. So the solution to that is that people should stop smoking. And then we have two types of smoking, really. We have active smoking and passive smoking. So those who smoke actively are at increased risk of developing stroke. The passive smokers are also at increased risk of developing stroke. So we need to encourage people to stop smoking, because even the person smoking may not be the only one at risk. His friend, who is just a passive smoker, could be at increased risk too. And then I talked about alcohol. So if someone drinks alcohol, the best is to stop drinking alcohol. And then I talked about obesity. If my weight is on the big side, okay, so I need to try and check weight. And then there will be lifestyle modifications that will be advised. So one will need to keep to those ones. So if I have any other problem, medical problem, some of the ones I've mentioned earlier on, the person will actually need to see his doctor so that the best advice could be given. And with that, we'll be able to reduce the burden of stroke.
All right. Stroke don't just happen, you know, it builds up. Are there symptoms to watch out for? Kindly share with us, Professor Wahab.
Absolutely. So stroke will give some signs. These are what we call the warning signs of stroke. And for everyone should be able to identify a stroke. Okay? So if you are somewhere and someone suddenly loses balance, okay, the person was walking normally and all of a sudden he loses his balance, it could be a stroke. So not that it is a stroke, but it could be. So one will need to evaluate the person. Okay, so loss of balance, even loss of vision, sudden loss of vision in one eye could be a sign of stroke. Or in actual fact, it's one of the warning signs of stroke. And then facial droop. You are talking with someone and all of a sudden the person's face droops on one side. It could be a sign of stroke. And you see the angle of the mouth deviating to one side. So that could be a sign of stroke. And then when the person is unable to lift the arm, okay, it could be a sign of stroke. So facial droop, arm weakness, these are signs of stroke. And then you are talking to someone and all of a sudden he's unable to talk to you again. Or he's talking to you but is incoherent. Okay, he has a slurry speech. That could be a sign of stroke too. And when all this happen, we say time is of essence. Time is neuron. We need to get the person to the hospital. So all these things I've talked about what we call B fast. B for balance, I for eye, F for face, A for arm, S for speech, and then T for time. So be fast when you think stroke has occurred.
Okay, I'll be fast when they feel stroke has occurred. Okay, what next should people around, caregivers do when this happens? In 30 seconds, so we can wrap up.
Right, so when you feel someone has suffered a stroke, the best is to take the person to the hospital. But there are some resuscitative measures that one could take because stroke will even announce its presence with sudden alteration in the level of consciousness. Okay, so you move to the person and try and do some resuscitation. Okay, no heroic thing because if you are not a medic, you may not be able to handle the situation. And even the most trained medic will not be able to handle stroke there. So the best is to get the person to the hospital as soon as possible.
You said we are experiencing an epidemic of stroke. What do you think young adults can do to mitigate this factor?
Young adults will need to take care of their health and they will need to avoid negative social influences. I've talked about some social factors. Okay, so smoking, alcohol consumption, smoking of marijuana, use of recreational drugs, heroin, marijuana, cocaine. These are things that can increase the risk of developing a stroke. And then as young adults, we should take interest in health and be proactive so that you check your health status regularly, check your blood pressure regularly, check your blood sugar regularly, and then engage in positive lifestyle, like exercising regularly, avoiding junks, and then if we are able to do all this, I think we'll be able to reduce the risk of stroke in the young.
Okay, embrace healthy lifestyle, stay active, be proactive about your health. Professor Kolawole Wahab, Professor of Medicine at University of Ilorin and consultant neurologist at University of Ilorin Teaching Hospital. Thank you so much for your time and tips on how to prevent stroke.
Thank you very much for having me.
All right, I have
Have a
been,
good. Right, bye.
all right, bye, sir. I have been speaking to Professor Kolawole Wahab, a consultant neurologist at University of Ilorin Teaching Hospital, as well as Professor of Medicine at University of Ilorin, on how to prevent stroke and reduce the epidemic of stroke. Sound Health continues with trending health report from around the world. Please stay tuned. All right, the program is still Sound Health on Lagos Television. Be fast and do not be a part of the statistics. Choose healthy lifestyle. Shun alcohol, smoking, and junks. You need to stay healthy and active. This is where we say thank you on today's episode of Sound Health. Remember, if you feel unwell or any of the symptoms shared by Professor Wahab, reach out to the nearest healthcare practitioner near you. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 00358266603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.